Dr. Xavier Tenorio is a plastic surgeon and director of aesthetics clinic in Switzerland. He specialises in plastic, reconstructive and aesthetic surgery. We spoke a couple of years ago and I asked him then, who needs plastic surgery, Xavier? Who should get plastic surgery? And you know what? I really liked his response back then. So this year, I started by asking him whether he remembered what he'd said to me.
I don't exactly remember, but I would have said, knowing myself, and my answer is that nobody needs plastic surgery. But when somebody really needs it and wants to have a change, it's like a project, and then we try to see if that project is feasible and we do it together. So it brings happiness.
That is almost word for word exactly what you said. And I love that answer. That's a really comforting, nice answer to remember, that nobody needs it. But of course, if you want it, it's good to know the best place that you can go and to know more about it. So with that in mind, can we touch on the clinics that you actually have and whereabouts you have clinics in Switzerland?
Kat, we have 4 clinics in Switzerland. The operation room and the main clinic is located in Geneva, in Champel. And then we have a consultation center downtown in Rue du Rhône, over the lake and on the shore of the lake. And then we have another clinic in the Montreux Palace in Montreux. And we have a 4th one in Gstaad at the Alpina Hotel.
And what kind of treatments do you cover across all of those?
Well, we cover everything related to plastic surgery. It can be non-surgical. If we are in the satellite clinics, we do consultations for cosmetic procedures. We do Botox, fillers, rejuvenation procedures. We have machines, lasers, slimming machines to increase the muscular mass. But in all of them, we consult for surgery. So if a patient needs the eyelids done, or a liposuction done, or fat transplantation, or breast augmentation, then the consultation is done in any of these locations and the procedure is done in Geneva.
Talking of breast augmentation, I know that you're really focused on particular new techniques, new technologies, and less invasive technologies as well, to keep that minimally invasive. Tell me about the latest in breast augmentation.
Well, we have come out with something that is absolutely phenomenal, that is perform a breast augmentation on local anesthesia in a procedure that is called minimal invasive. And do you want to know why we call it minimal invasive?
I'd like that, yes.
It is called minimal invasive because the incision that is done to place the implant, it makes only 2.5 centimeters. And then there is no dissection. We put a balloon in the area where we're going to put the implant that expands the tissue. And that preserves everything, the vessels, the nerves, the sensation. And given there is no dissection whatsoever and the implant is placed with no effort, then the recovery is quick. And the patient can go back to normal life, let's say the day after.
That's incredibly speedy. Would you expect there to be some sensitivity afterwards?
It is indeed. We inject a local anesthetic, that is a deposit local anesthetic that works for several days. And at the same time, when the patient is discharged, it has some medication, painkillers, in order to prevent any pain. So patients don't suffer. And the most important thing is that we overwhelm the fear of the anesthesia. Lots of people say, "Doctor, I'm very, very afraid of having a general anesthesia." So this shortcuts that and allows the procedure to be done on local anesthesia with the patient awake. Yesterday I did one and we were talking about my client's job and she was telling me how fascinating it is. So it's really amazing.
So you get to have a little chat with the patient as you go.
Oh, yeah. Oh, yes. Just fascinating to have a chat about something that may be interesting at the same time that we do the procedure.
In terms of that, if someone is a little squeamish, though, how do we make sure that they're not going to be squeamish about something that's going on whilst they're only under local anesthetic?
That is a fantastic question because that can happen. But obviously, we have an anesthesiologist with us. And the patient has an IV and everything. So if there is a need for any reason, we can switch into a general anesthesia very simply.
Oh, wow. So could be changed. And how many patients have you now done this on? This must be something this is fairly new, isn't it?
Well, the concept of doing minimal invasive is super new, but doing the small procedures on local anesthesia I've been doing for over 12 years, I would like to say. So hundreds of cases on local. But the introducing a balloon in order to create the space and preventing cutting anything in the breast, that is new. And we have done a bunch of implantations with this technique. But the principle of doing local anesthesia is already very old.
And the wait times?
Well, you need to have, we give you a time to think about it. Basically, after discussing this, we do a 3D reconstruction. So you have a very clear idea of how it's going to look like afterwards. And we give you some time to think about it. And then when you have decided, we can set up a date. And because we own our own surgical, our own operation room, then the procedure can be scheduled within 4 weeks.
Who is the best candidate for this sort of procedure?
Well, ideally, patients who want to have a small enhancement, patients who want to just have a little bit more or recover the volume or the size that was previous breastfeeding, for example. Or also patients who have a very small breast and just want to have one size up. So they are very good candidates because obviously a small implant will solve all the problems.
And does it last?
Oh, wow, that's a fantastic question. It is, the implants change as everything, as your mobile phone, as your car. Everything changes most of the time in a better way. So today, implants are almost indestructible. They are extremely elastic, and it's almost impossible to break it. So they are safer than before. And let's say that the normal life of an implant is between 10 to 15 years. The new implants may last a little bit longer. We don't really know, but we will have to follow up that. But I expect that it will last over 15 years.
And if people would like to find out more, if they would like to book that consultation, where do they go?
They will have to come to any of our clinics, aesthetics clinics. The major consultation center is in Geneva and Rue du Rhône, or we can see you in Montreux or Gstaad. Our website is aesthetics-ge.ch, and we are available all the time for you.
That's Dr. Xavier Tenorio, the plastic surgeon and director of Aesthetics Clinic in Switzerland, reminding us that no one needs it, but if you want it, they are there. Should you want to know more, that website again is aesthetics-ge.ch. We'll put a link up on our website.